And you're watching Skin Sense. I'm your host, Janine Mazurkevich, and we're here at the Dermatology Center, and we're talking about Health 911. It is health911.com that we're talking about on how you're going to be able to get these products. You could also get them here locally at the Dermatology Center located on Laurel Street in downtown Hazleton, Pennsylvania. And Ted is the owner of Health 911. We're taking a break to show you some of the products because the skin line products are really the products that we're focusing on with Dr. Schleicher's show here, Skin Sense. And Marianne is back with us to tell us in depth about some of these products that are available.
Exactly. And again, what I've done is put together a line for various modalities. And probably the line that has most relevance would be the acne line, mainly because there are millions of people out there with acne. And what do you use? Okay, and a line that I've been using in my office, I've kind of converted to Health 911 in deference to Ted. By the way, his website gets, some 5 million hits per month. So that is huge, and he has a global audience as well. Okay, and the fact that acne just in the U.S. affects, 20, 30 million Americans. Yeah, there are millions of people out there, and we're trying to develop lines that will help these people. And of course, Marianne deals with acne on a daily basis, and she can even go over some of the products we have for acne.
Sure, we can start.
Yeah, we could probably start whichever you want. Benzoyl peroxide would be fine.
I think we'll start with the benzoyl peroxide. We have the benzoyl peroxide wash, which is a great wash for, as the doctor said, the acne-prone skin. It comes in the two different strengths, the 5% and the 10%. The 10% sometimes can be a little drying for patients, so sometimes we'll start them on a 5% wash. It's very good in drying up the pores and helping with excess oils on the skin. If it becomes too drying, you can use it less frequently. But in place of soap, use the benzoyl peroxide gel.
Yeah, and let me just interject that benzoyl peroxide actually kills germs as well. Okay, besides drying up oils, it kills germs, and that's important because one of the major factors that contributes to acne are certain germs that live on the skin surface. And some of the medicines that we use, the germs can actually develop a resistance to, and if they don't work anymore. That will not happen with benzoyl peroxide. That kills germs on site, which is great.
Right. And we talked about sometimes products can be too drying. You have to create a sort of balance with patients' skin. You can't get them too dried out. You can't let them remain too oily because either one or the other, one's going to block the pores or one's going to make you too dry. If you become too dry, we have a light textured moisturizer, which also works very well. Very often patients will come into our office and ask, is there something I can use that's not going to clog my pores? And again, you don't want to undo what you're trying to do with the products. So we have a light textured moisturizer that can be used as frequently as necessary if the skin does become too dry. So that's a nice product. We have a clay mint mask. Once again, sometimes people have such oily skin that they want to enhance their treatments with a mask. And some people like the feel of a mask, and they feel it cleanses the pores, which it does. And ours is a nice green clay mint mask, and it can be used once or twice a week, however frequently the patient feels that they would benefit from it, or whatever the doctor would recommend. Again, you wouldn't overwork your skin. You wouldn't use this product every night, but to enhance the treatments further, we have the mask. There's also glycolic acid pads, which act a little bit like, if people know the Stridex pads, that you buy over the counter, but these are much more advanced. And the salicylic acid is another product that helps to open up those pores, and cleanse the skin, gives it a nice texture, and as far as the oils, will calm down the oily effect of the skin. There are two different types of pads. The Glysal 2.5 or 2% salicylic acid, and the higher strength. So again, depending on the person's skin and what kind of regimen the doctor puts them on, that would determine which one they would use. So that's kind of basically our acne line, and I think that, in addition to any prescriptions that the doctor may recommend, should take care of people. And also, I forgot to mention, with the Glysal pads, there's the salicylic acid in here and the glycolic acid. Glycolic acid is a fruit acid, and that again will help to smooth the skin's texture and help dry up oils and things like that.
So we're not seeing alcohol in these products?
No, alcohol can be very drying to the skin. There are some alcohol-based products. You may see alcohol in some manner, shape, or form with acne products. But then again, you have to be very careful not to dry the patient's skin out.
All right, you have some shampoo there as well?
Yes, we have quite a few different shampoos. Let's see where we can start here with
Probably
these.
the two we'll probably talk about are basically the therapeutic shampoos, and one contains zinc and one contains tar. And both of these are proven ingredients for a condition called seborrheic dermatitis. And what's seborrheic dermatitis? Well, that's dandruff. And how many people out there have itchy scalps? And then over time, you not only itch, but in some individuals you get redness, and besides it doesn't look good, it doesn't feel good. How do you treat it? Well, sometimes we need prescription medications, but sometimes just the shampoos alone will do the trick. Okay, and again, we have one that contains zinc, one that contains tar.
The tar shampoo is, of course, the brown colored one, and the other one is more of a clear shampoo. Sometimes patients are a little concerned, doctor, aren't they, with the tar shampoo as far as staining the hair?
Yeah,
Janine is already looking at me. Do we pave the road with this, or what do we do with this?
Yeah,
right?
looks like honey.
But no, actually, it doesn't even have that strong tar smell that a lot of the tar products in the past have had. So they're both very good products, as doctor said, for the seborrheic dermatitis conditions, the dandruff, and the psoriasis.
When we talk about traditional
scale.
therapies, well, tar has been around for probably 70 to 100 years.
Yes.
And that was one of the original treatments for psoriasis. And it works great for psoriasis. The problem is tars have a little bit of an odor. So people don't want to put it on their bodies and then go walking around smelling like they were working on a road crew.
Wasn't there actually a tar remedy that they would put on people's bodies for, like you said, the psoriasis, and then put them in a light box?
Absolutely.
It would
Absolutely.
help. It would help
Yep.
enhance the treatment.
Yep.
Now, with
Yep.
every good product, you only have to use a little bit of these, I'm assuming?
Yeah, what you want to do is lather up. That's a very good point, actually, because since these are medicated shampoos, you do want to lather, and you do want to leave it on the scalp. So the longer you leave it on the scalp, the better. So if you leave it on for 3 minutes, great. If you leave it on for 5 minutes, even better. Okay, and one thing we might mention is the zinc shampoo. Zinc is also therapeutic in regards to acne. So when I see individuals who have a lot of pimples around their forehead, what I'll tell them to do is use a zinc shampoo, lather their forehead as well. Leave that on for a few
So you're
minutes.
getting a 2-for-1 right there.
Basically, yeah.
That's right.
Yeah,
So that actually
Yep.
can be put in line here with our acne products too.
Okay.
Okay.
And what else do you have there? What other goodies do you have?
We have hair conditioners, of course, and as doctor mentioned, we have hair thinning shampoos. There's 4 or 5 different shampoos. Very often we go into the next category of people who ask us about the anti-aging treatments that we have. We have a green tea fortified cleanser. That is as it says, a fortified cleanser that is a non-soap type cleanser. And this will be good for people that, you know, their skin is aging, they're becoming maybe a little bit dry and whatnot, will not dry out the skin. It wouldn't be something like, you know, that some other products really do a number on people. If they already have dry skin and they're prone to wrinkling, sometimes they dry their skin out to the point where their skin even becomes red and itchy. That would not happen with this product. So we have that. We also have a 10% glycolic moisturizing lotion, and this is very nice. This is put on, it's used as a moisturizer basically under your makeup. You put this on after you've washed your face, patted it dry. It has the glycolic acid in it, the 10%, which again, as we spoke about, glycolic acid is a fruit acid, and it's very mild and gentle. It's not going to dry out the skin. And it helps with fine lines and wrinkles, helps to smooth the skin. So that is another product that's very popular with our older population, but not only the older people, I mean younger people too. I mean, to prevent getting those first lines and wrinkles, it's good for that. So we have that, and then again we have a vitamin C eye cream. People often ask, what do you do with that tender skin under the eyes? So you don't want to put anything, dark circles. It'll help a little bit with that too. Dark circles are a little tough, but anything that with vitamin C helps to, again, smooth the skin, keeps that nice taunt and area smooth and doesn't irritate.
All right, so you can get any more information either by calling the Dermatology Center, or obviously the number is on your screen. And how long have you had these in your office?
We've had these for about 6 months. Okay. And I might also add, you can go up to the health911.com website, and you know, you can order right from the site. Okay, so, and again, the site's global.
One of us on the street. right?
Yeah, usually I don't sell them on the street, but if things get really bad, you may see me out there. I don't know yet.
Okay, well, when we come back here on Skin Sense, again, we're talking about Health 911. We're going to bring Ted back and wrap up our show with some other remedies. It might be something that you have a question about. You can go right to the website, or you can go to our website as well and check out Skin Sense at ssptv.com. We'll be right back.